Brolucizumab in Indian population. I have no financial disclosure. A brief overview about intravitreal Brolucizumab. As we know, it is known by as Paginax. It was mainly approved by the FDA for...
1 second.
Slide.
Yeah, please continue.
Mainly approved by the FDA for neovascular age-related macular degeneration in 2019 and diabetic macular edema by 2022. The main important catchy thing about Brolucizumab is that it lacks the fragment constant region. It is mainly composed of only the single chain variable fragments, about 252 amino acids. It is mainly generated from the naive human spleen DNA. The complement determining regions were grafted to soluble human fragment variable regions from the binding site. The mechanism of action, as we can see, blocks mainly the VEGF R1 and R2 receptors, and thereby leading to decreased growth of neovascular lesions and thereby resolving the retinal edema. The main thing is that the molecular weight of Brolucizumab is about 26 kilodaltons, which is many times smaller when compared to that of the other anti-VEGF agents, thereby leading to higher molar mosses and thereby leading to higher drug concentration, ultimately reaching better depths of penetrations. So our aim of our study is to determine the functional and anatomical outcomes and also to see the safety profile of Brolucizumab in patients, especially with recalcitrant macular edema, who have at least received 3 doses of Avastin. Ours was a retrospective study which was conducted between July 2021 and December 2022. The following parameters such as the demographic parameters, indications, central foveal thickness, baseline intraocular pressure and IOP at each follow-up were also followed up. And we also looked for the OCT biomarkers for predicting the outcomes of our study. Patients with recalcitrant macular edema with at least recalcitrant to at least 3 injections of Avastin of the following indications were included, such as age-related macular degeneration, diabetic macular edema and retinal vein occlusion. Patients were at least followed for 3 months. Patients with poor vision and less than 3 doses of intravitreal Avastin and pre-existing glaucoma, and patients with less than 3 months of follow-up, and with those who underwent any intraocular surgery within less than 3 months were excluded from our study. So this is the flow chart. The patients who had recalcitrant macular edema with more than 3 doses of Avastin were included, and they were injected with intravitreal Brolucizumab, and they were followed up for 3 months initially and then followed 6 months. So about 9 cases were belonging to the age-related macular degeneration, and 13 patients were of diabetic macular edema, and 3 patients had retinal vein occlusion in our study. The visual outcome was also good. It also showed an improvement at the end of the 3 months. The central foveal thickness also showed a good reduction from the baseline. This is the OCT picture showing the resolution of the macular edema. The IOP response was also favorable. So we looked for the markers such as intraretinal fluid, subretinal fluid and subfoveal hyperreflective material in the study to predict the visual outcome and the anatomical outcomes. About 23 cases had subretinal fluid, and the intraretinal fluid and subretinal subfoveal hyperreflective material was found in each cases. All of the cases, about 24 cases showed a resolution of the fluid. This is a comparison between the Avastin. As we can see that the Avastin has about 3 injections compared to that of the Brolucizumab have only 1 injection. And there was a significant reduction, about 1/3 number of injections were reduced from comparing to the Avastin to that of Brolucizumab. We had anterior uveitis and congestion in about 2 and 1 cases respectively. So this is a short-term follow-up and we have a smaller sample size. So 23 eyes of 25 years showed a complete response, that is the complete drying of the edema or the fluid, and 17 patients had a complete resolution. The central foveal thickness showed a 60.83% reduction from the baseline. The average number of injections of Brolucizumab was found to be about 1.4, and the average interval between the 2 injections of Brolucizumab is found to be 4.5, which is higher than any other anti-VEGF. So Brolucizumab is safe and effective in patients with recalcitrant edema who are recalcitrant to other cases. These are my references, and thank you.
So you had 2 cases of anterior uveitis and your total sample size was how many patients?
25 more.
So that is quite significant. And you have given hardly 1 injection, right?
Yes, ma'am.
How many injections per patient?
Only one.
So these two with anterior uveitis, did they receive repeat injections?
No,
Or
ma'am.
was this with just one injection?
Only one.
So that is a significant safety issue. That in
Okay.
just 25 patients, you have 2 patients who have had a reaction because your title says safety and efficacy. Yeah?
Yes, ma'am.
And how many of your Avastin patients, did they have any reaction?
No,
Over
ma'am.
so many you had given.
None of them.
So I think if you want to compare, you have to have that data of comparing bevacizumab with brolucizumab.
Yes, ma'am.
Yeah, please.
Thank you. Now we can have a next.
I just have a comment. Why did you say in the title that it is in you are looking at safety and efficacy in Indian population
Indian
when the sample is just so small?
Yes, sir. That is our limitation. We have
So
only small number.
you must be very careful when you write such
Okay.
a title. Indian population.
Indian population. Okay.